and good day, ma'am. By the way, my name is Syphilis and I am going to discuss about syphilis. Okay, so syphilis is a sexually transmitted bacterial infection usually spread by sexual contact. Syphilis has been known as the great imitator as it may cause symptoms similar to many other diseases. It's caused by the type of bacteria known as Treponema pallidum. Sometimes it refers to treponems, or it can also be referred to as spirochete, which is a name for a group of bacteria that looks like this when you expect a sample which has been infected with syphilis under a microscope. The most common way syphilis is spread is through contact with an infected person or during sexual activity. The bacteria enter the body through the minor cuts or abrasions in the skin or mucous membranes. Accordingly, in 2016, more than 88,000 cases of syphilis were reported in the United States. The rate of women in syphilis has been declining, but the rate of men has been rising. STI transmitted from one person to another. As I've said earlier, the most common transmission is sex. That includes oral sex, vaginal sex, and anal sex. The signs and symptoms of syphilis vary based on the stage of the infection. There are 4 stages in all. Each stage has different signs and symptoms. Some symptoms are classic, meaning clear signs of the disease, while others are non-specific and easily confused for other conditions. Okay, primary stage. The first sign of syphilis is a small sore called a chancre. The sore appears at the spot where the bacteria entered your body, while most people infected with syphilis develop only one chancre. Some people develop several of them. The chancre usually develops about 3 weeks after exposure. Many people who have syphilis don't notice the chancre because it's usually painless and it may be hidden within the vagina or rectum. The chancre will heal on its own within 3 to 6 weeks. Secondary syphilis or secondary stage. Sore throat and skin rash may develop during the second stage of syphilis. Within a few weeks of the original chancre healing, the infected person may experience a rash that begins on his trunk but eventually covers his entire body, even the palms of his hand and the soles of his feet. This rash is usually not itchy and may be accompanied by wart-like sores in his or her mouth or genital area. Other symptoms of syphilis may include headache, swollen lymph nodes, fatigue, fever, weight loss, hair loss, and aching joints. These signs and symptoms may disappear within a few weeks or repeatedly come and go for as long as a year. Okay, let me proceed to the latent syphilis or the latent stage, also called hidden stage. If the person isn't treated for syphilis, the disease moves from the secondary stage to the latent or hidden stage when the person has no symptoms. This stage can last for years. Signs and symptoms may never return, or the disease may progress to the third or tertiary stage. Tertiary stage. According to the Mayo Clinic, about 50% to 30% of people infected with syphilis who don't get treatment will develop complication known as tertiary syphilis. In the late stage, the disease may damage the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. These problems may occur many years or decades after infection, and it can also be life-threatening. Syphilis can be diagnosed by testing samples of this too. Okay, blood. Blood tests can confirm the presence of antibodies that the body produces to fight infection. The antibodies to the syphilis causing bacteria remain in his or her body for years. So the test can be used to determine a current or past infection. Next one is cerebrospinal fluid. If it's suspected that he or she have nervous system complications of syphilis, his or her doctor may also suggest collecting a sample of cerebrospinal fluid through a lumbar puncture. When diagnosed and treated in its early stages, syphilis is easy to cure. The preferred treatment at all stages is penicillin, an antibiotic medication that can kill the organism that causes syphilis. But if he or she is allergic to penicillin, his doctor may suggest another antibiotic or recommend penicillin desensitization. To The recommended treatment for primary, secondary, or early stage latent syphilis, which refers to an infection within the last year, is a single injection of penicillin. If that infected person had syphilis for longer than a year, he may need additional doses. Penicillin is the only recommended treatment for pregnant women with syphilis. Women who are allergic to penicillin can undergo a desensitization process that may allow them to take penicillin. Accordingly, there is no vaccine for syphilis, but here are the 3 suggestions to help prevent the spread of syphilis. First is abstain or be monogamous. The only certain way to avoid syphilis is to avoid abstain from having sex. The next best option is to have mutually monogamous sex in which both partners have sex only with each other and neither partner is infected. The second one is use a latex condom. Condoms can reduce risk of contracting syphilis, but only if the condom covers the syphilis source. The third one is avoid recreational drugs. Misuse of alcohol or other drugs can inhibit your judgment and lead to unsafe sexual practices. So I think that would be all. Thank you for watching.